Hello. Magandang madaling araw. Actually, it's very early in the morning. So what we'll be having now is that we'll be rationalizing some Palmer questions. So uh, we have already, I think, 19 actually with us early in the morning. So padamihin pa po natin. Let's wait for the others to come. Okay, and pumasok sa ating room and then we will start. Uh, So mga kapatid, let's start discussing this one. Okay? So, kumusta naman? Ah, Preparations pa din, no? Para sa ating nearest board examination. Of course, so I hope everyone is doing well right there. Okay, so let's start doing this one. So, konting practice po kahit sa pinakamalapit na part. And then, guys, I would like to ask a favor from you that as we go near the board examination, of course, no. I mean, in the examination itself, let's have some discussions then, no. What are those na lumabas on your examination so that we can improve, no, and we can help more others. Okay. So, ayan. We have, I think may some students din ako dito, no. Ana Zazet, Katamko, Sir Paulo, Joseph, John Prey, member po ng ating channel, Paulo Manuel, Ively, Erica Yabut, Joseph, Mai, Hera Fuyok, and so Alisa Pugal is also here. Okay, so let's start this one, kapatid. Okay. So when the nurse is providing care to a patient or to the patient using a multidisciplinary team approach, which other healthcare workers this process is called? Okay, sabi sa letter A, proactive care. Letter B, dynamic care. Letter C, collaborative care. Letter D, reactive care. What do you think is the answer, kapatid? I'll give you a seconds, siguro mga 30 seconds to answer this one. You can drop down your answers. Hello also kay Samantha Nieva. Yan. Kumusta kapatid? I hope you're doing well also. Yan. So, what do you think is the answer here? So, when the nurse daw is providing care to a patient, kapatid, using a multidisciplinary team, okay, multidisciplinary team approach. So, alamin natin kung ano nga ba talaga ang ginagamit dito ni patient. Okay? So, multidisciplinary, big word. This is our key term here. multidisciplinary team approach with other healthcare workers. And this process is called, so ano daw ang tawag natin sa process na to? Okay? So, kapatid, when you say you are trying to coordinate or you are trying to connect, okay? You are trying to connect with other profession, with other discipline, yan, with other yes, sciences in our healthcare system, other allied health sciences in the healthcare team. That's what we call, that's where you are actually collaborating care. Okay, so the best answer for this one is of course letter C. Okay, letter C po ang tamang sagot. I will be using green ink para din, no? Hindi siya mukhang mali. Okay? So, of course, the best answer here, kapatid, is letter yan. You are actually doing a collaborative care. No-brainer to, no? You are trying to connect with other allied health sciences or members of the healthcare team. So, it's very essential, no, na nakikipag-collaborate si nurse. So, kapatid, kapag hindi ninyo nahanap yung collaborative, you may find the word coordinate, okay, coordinator, or you may also find of course, no, um multi-care, okay, multi-care function, okay. So kapag hindi mo nahanap ito, actually pare-pareho lang sila ng meaning, okay. So that's it. Parang everyone naman get the correct answer with this one. This is quite easy, okay. So let's have another question, kapatid. Okay, so next one, James is being discharged from the medical unit. Okay. He asked Nurse Nadine regarding PhilHealth processing so that he can avail his benefits. So Nurse Nadine told the patient that she will inform him after she has reviewed it. So Nurse Nadine contacted the local office of PhilHealth to ask the relevant information about the client's concern and relayed it to the patient. So what ethical principle does the situation represent? Sa madaling sabi, si James gusto niyang magpa-process ng PhilHealth. Ngayon kapag tulungan siya ni Nurse Nadine, what is the ethical principle, no, ang nire-represent ng situation na ito? Sabi sa letter A, autonomy. Letter B, fidelity. Letter C, beneficence. How about letter D, kapatid? Non-maleficence. What do you think is the answer? Okay, what do you think is the answer, kapatid? Yan. What do you think is the answer? I'm seeing a lot of may B tayo dito. B, B, fidelity. Yan. Okay? Yan. So kapatid, kapag ganito ang tanungan, yan, the relevant information na, I mean the relevant or the keyword na makikita natin, kapatid, sa inyong tanong is that ang ginawa dito ni Nurse Nadine, no? She contacted the local office to ask relevant information, talagang tinanong niya about the client's concern and related to the patient. So, Nurse Nadine did here an extra mile, no? So, kapag ganyan, kapatid, your loyalty or your fidelity, no? Kapag hindi ninyo nahanap, um, kapag hindi ninyo nahanap yung word na fidelity, you look for the word na you became a patient's advocate. So you become loyal to your patient. Yan. So you become loyal to your patient, you stood by your patient, kapatid. Kahit ano mangyari, talagang tutulungan mong pasyente mo. So the best answer here, kapatid, would be of course letter B, fidelity. Okay? So you became a patient's advocate here. Okay? So let's have another answer. I mean, let's have another question. Okay? So, ayan. What principle involves disclosure of the necessary information to the patient, making sure that he understands the information so he can voluntarily make sound decisions concerning his care? Letter A, autonomy. Letter B, fidelity. Letter C, beneficence. Letter D, non-maleficence. What do you think is the answer? Ayan. Yan, dumadami tayo Okay. So what do you think is the answer here? This is quite easy. No-brainer question, kapatid. Okay? So seeing A here, a lot of A's, everyone's answering A, of course, no? So of course, so kapag kapatid, I have to highlight this one, make sound decisions. So you have provided the necessary information, yan, binigay mo yung mga specific information kay patient so that maintindihan niya. So you are giving the patient's education, or you are trying to be facilitative when it comes to the information, kasi hindi dapat natin ino-hold yung mga certain information, kapatid, na necessary for the progress of the patient, no? So dito, ang purpose mo is for the patient to have to voluntarily make sound decisions, okay, para sila maging free. So of course, big word dito, kapatid, the big word is autonomy. Kapatid, kapag hindi mo mahanap na yung autonomy, kapatid, okay, kapag hindi mo mahanap yung autonomy na word, you look for freedom, yan, freedom from coercion. Yan, usually yan yung ginagamit na term ng ating Board of Nursing. So, if you are not able to see that, you look for the word like your freedom of coercion, freedom from any unjust um, or insistent, any manner wherein you are being insisted to do something. Yan. Freedom from any force. Okay? Uh, so that's what we call as your autonomy. Dapat malaya tayo no, na makapag-decide. So freedom from threatening. Yan. So autonomy po ang tamang sagot dito. Okay? So let's have another answer, kapatid. Another question. Yan. Yan. I have given this question actually in my Facebook page and also in my TikTok. So a collision of two buses on the Venetia Highway in Dagupan City left 6 persons dead and 36 others injured. So the nurse used triaging. Yeah. Big word there, kapatid, triaging to the casualty. So what ethical principle does the situation represent? Okay, so I will make this very, very fast, kapatid. Kapag sinabi nating triaging, what you are just doing here is you are just being fair. Kasi you are treating patients according to the degree of their injuries, because in triaging, di ba, we are using tagging. Di ba? We are using tagging by means of color like in black, red, green, yellow. So kapag not necessarily, there are some hospitals now, it depends always on the hospital policies. There are some hospitals who doesn't anymore use like the yellow coding or tagging. So what they just use, they can use by numbers or they can use it by their clinical eye judgment. So kapag triaging, kapatid, ang ginagawa ng isang nurse or ng isang institution, you're applying here fairness. So ang fairness po natin, ang tawag natin dyan is of course justice. Okay? D is the correct answer here, kapatid. Okay, letter D is the correct answer. Parang, yeah, everyone naman is getting the right answers. Yeah, it means, and it's a symbol wherein you are already um okay, you're already ready. No, you are all ready for the board exam. So may question po dito. Good morning, sir. Pag di ba po malpractice, professional malpractice with or without injury, pero yung negligence, non-professional, simple injury. So this has been actually also one of the discussions we had when we had in our 3-day review. Mainit-init na discussion to, no? I have some students still asking me, sir, if what is the difference of malpractice and um, uh, negligence. Alam nyo, sige, briefly we will discuss it here. Kapatid, para mas madali nating malaman, malpractice, kapatid, malpractice, yan. Malpractice, kasi ang definition that we have in Lydia Benson's book, yes, it's very, very bookish, pero para mas maintindihan ninyo when it's already applied in questions, because you will be facing the PNLE in few days. So, malpractice, kapatid, is the unprofessional, yan, unprofessional, okay, or the illegal, yan, unprofessional illegal conduct, yan, conduct. Okay, yes, this is kind of legal definition, but this is not that legal that you cannot understand each question as it may be applied in your PNL questions. So what I'm trying to teach you here is I will be defining it in a manner that you can understand how are you going to apply it whenever such question is asked on you on the board exam. Okay, so this is the unprofessional or illegal conduct. Okay, or dispensation. Those are the words, no? Or dispensation. Yan. Dispensation of practice. Yan. Of professional practice. Okay? So, or of practice itself. So, tama tayo dito kapatid na hindi kailangan ng injury, no? So ang mahalagang halimbawa nito kapatid. Okay, so I will be telling you here ang pinakamahalagang halimbawa nito, no? Kung when do we say that it's a malpractice. Ang pinakasikat dito na halimbawa is yung reseta. Yung pagre-reseta ni nurse kapatid, you are not allowed to do that. And that's not according to the scope of your practice. So this is the illegal conduct, no? Sa madaling sabi si malpractice, not all, but siya yung paggawa ng isang bagay na hindi mo naman trabaho. Okay, reseta. Number two, ayan, bribery in healthcare. You are instructed to do something, no? In exchange of another thing. Reseta, bribery, um, um, yan, conduct of suturing, yeah, or suturing na hindi ka naman allowed or hindi ka trained. Yan yung episuraphy without training, episuraphy, yan, or episiotomy, yan, episiotomy without training, yung mga ganyan. Those are malpractices. Okay? So, halimbawa sa reseta, kapag nagreseta ka, hindi naman kailangan meron kapatid injury. Di ba? The moment na nagreseta ka, because it's not your job, hindi mo trabaho yan, okay, kahit walang injury, it's already malpractice. Okay? So, on the other hand naman kapatid, ito, klarong-klarong dinefine ni Leja at Roland Venson. That negligence kapatid is the commission, yan, commission or omission of an act. So, okay, so ibig sabihin, ginawa or may hindi ginawa, okay, leading to an injury. Yan, so may hindi ginawa si nurse tapos nagkaroon ng injury. Okay? So diyan na lumalabas kapatid yung mga halimbawa, yung mga hindi na ibigay. So that's omission. Omission. So hindi na ibigay yung medicine, yung certain drug tapos nagkaroon ng ganitong reaction sa pasyente. So that's omission. Commission naman is binigyan mo ng drug na hindi tama. Yan. Isa din sa mga napakalaking pag-difference, no? When it comes to malpractice kapatid, this is the conscious. Okay, this is the conscious or intentional. Okay, this is the conscious or intentional commitment of something or of an act. Okay? Upon the other hand kapatid, sa negligence naman, okay, this is usually culpa or merong pagkakamali. Okay? So, uh, kolpa or meron tayo dito tinatawag na kasi apat ang element nito kapatid or meron ditong usually unintentional siya. Okay? Unintentional. So you write that down kapatid. Halimbawa, ano, um when you unconsciously have given a patient a wrong medication or such as say for example a medication kapatid na nag-lead to other halimbawa adverse effect or hypersensitivity or anaphylactic reaction to your patient, so na hindi mo pala no na i-check halimbawa that certain medication needs to be skin tested pala sa pasyente before you are able to give it, so that's already negligence because meron siyang apat na element. So ang apat na element po ng negligence, number one is dapat duty, may duty si nurse. Ano ba yung mga elements nito? I will write it down kapatid. Okay, dapat duty. So you cannot, alam niyo napakadali lang dito. You cannot charge a person of negligence, lalo na si nurse, no? Whenever this is not anymore within the scope of his or her responsibility. Okay? So kapag responsibility ni doktor yung ginawa, walang negligence dito kapatid. And at the same time, the presence also of the nurse. Okay? So number two kapatid is nandyan na kapatid yung malice. Okay? Yung nandyan yung pagkakamali. Okay? Malice or culpa. Yan. Okay? Nandyan din kapatid number three is yung foreseeability. Foreseeability of the injury. Yan, perceivability of the injury. So dapat natitrace yung injury na simula talaga doon sa duty na yan. So it needs to be proven, no, in courts. So number 4 naman kapatid is the injury itself. Actually, the injury itself is the most important element, okay, of the 4 elements of your negligence. So, yan kapatid ang napakalaking pagkakaiba ng malpractice at saka negligence. Mamaya baka may dadaanan tayo dito, no? We might be reading some of those questions here. So, ayan. Halimbawa, binayaran si nurse para ganito. So, that's malpractice. Okay? So, kasi you are conscious eh. Nung nagreseta ka, you're also conscious. Intentional yon because alam mo namang hindi ka doktor. Okay? Hindi mo pwedeng sabihin na, hala, hindi ko alam na hindi pala pwedeng magreseta si nurse. No. You've been in the nursing school for 4 years at alam mo kahit isang beses hindi tayo gumawa ng reseta, di ba? What we did is your uh, nursing care plan, your NCP, na paulit-ulit. Okay? So, I hope na nakatulong yan, kapatid. Okay? So, let's have another question here. Hospital put up triage schemes to determine who should be first served. It was taught by ER head nurse to nurse Carl, and this follows a deontology. A letter B, beneficence. Letter C, non-maleficence. Letter D, justice. Alam nyo, still the correct answer for this one is justice. Again, if you see that word triage, kapatid, yan, the word triage, it's actually a keyword. Therefore, the best answer here, kapatid, is your justice. It's really a keyword. Kapag nakakakita kayo, kapatid, ng heavy word in the question that would lead you to understand, okay, what is the question all about? What the question is asking and versus what's the available options. So, madali na lang sa'yo. Okay? So, ayan. Let's have another question. Okay. Confidential information may be revealed only when, letter A, patient never permitted to reveal. Letter B, patient is ill of leukemia. Letter C, patient verbalized plan to commit suicide. Letter D, the family lawyer of the patient came and asked. Yan. So, what do you think is the confidential information? Yeah. What do you think is the answer here? This is kind of easy, but tricky siya. It's because uh, there's a hidden concept here. So, what do you think is the answer? A, B, C, or D? Yeah. Letter A, when patient never permitted to reveal. Letter B, patient is ill of leukemia. Letter C, patient verbalized plan to commit suicide. Letter D, family lawyer. Alam nyo, napakadali lang ng question na to. Although, this is kind of tricky. So, ang pinakaunang-unang hindi mo isasagot dito, kapatid, is si letter D. Okay? Kahit na family lawyer yan, walang karapatan si lawyer, kapatid, na mag-access ng patient's chart. Okay? So, yan. Okay, so lalo-lalo na si letter A because the patient never permitted to reveal. So, in the first place, it's a standard operational procedure or standard protocol yan na you cannot really reveal it. Okay? So, what do you think is the answer? Yan. So, yan. Correct tayo dyan, Paulo Manuel. Confidentiality patient allows revelation, threat to public safety, or court order. Ayan. So, dahil may threat na dito, kapatid, to the safety. Okay? So letter C, kapatid, is the correct answer. Okay? So of course, no, you may say to your healthcare team na upon endorsement, no? Okay, upon endorsement or haggle na as one of your patient actually verbalized no ng committing suicide. So that's something that you should share within the healthcare team. Okay? Ayan. Sige. Let's have another question. Okay. Sige. Let's have another question. Nurse Carl and Nurse Justine are co-workers in OB ward. So during their duty, both went to the restroom and did not come back after 30 minutes. So the head security went to the restroom, opened one cubicle, and saw Nurse Carl engaging homosexual behaviors to Nurse Justine. So this act can fall under letter A, negligence. Letter B, malpractice. Letter C, moral turpitude. Letter D, none of the above. What do you think is the answer here? Okay. Yan. So, there's parang may sexual, no? May sexual act between the two. Okay? So, what do you think is the answer dito, kapatid? Nakita sila at nahuli sila ng security guard no ng hospital. Okay? So, what act no, or ano ba ang situation na meron tayo ngayon dito? Okay? What do you think is the answer? Is it negligence? Alam nyo, ang negligence, hindi sinasadya. Hindi ko pwede sabihin no. Okay? So, malpractice, yan. Ayan. So, correct answer natin dito, kapatid, is letter. Yan. Reveal natin, kapatid. Let's eliminate letter A. So, you cannot have negligence here. This is not negligence, clearly, no? So, um, the best answer dito, kapatid, is your letter C, moral turpitude. Ayan. So, let's define moral turpitude, kapatid. When you say moral turpitude, this is an act of baseness. Yan. This is an act of baseness or vileness. Sa madaling salita, this is kawalang hiyaan. Yan. Kawalang hiyaan. Yan. So, it's like you are when you try to degrade the uh, reputational risk, no? When you try to put a reputational risk on the profession, so that is an act of baseness or vileness, ayon kay Lydia Benson. So, kawalang hiyaan daw yan. So, that's an example of moral turpitude, kapatid. Okay? So, eto, Nurse Carl and Nurse Justine and co-workers and OB-ward, so during your duty, they went to the restroom and did not come back after 30 minutes. Okay, so the head security went to the restroom and they were engaging homosexual behaviors. Okay? Okay, so the two, no, were doing that thing. So, well, insofar as this one is highly ethical because this is quite this might put everyone, no, or the one who made this one maybe put it into question. Well, um in so far as the right of the persons is concerned, they may do that, but not necessarily within the time of their or the duration of their duty. Okay, so that's why it's within moral turpitude. Okay, so letter C is the answer here, kapatid. Okay, so let's have another question. The patient underwent exploratory laparotomy 5 hours ago. So when the patient has regained consciousness, he asked the recovery room nurse about the findings recognized through the procedure. So the nurse informed the surgeon to explain the patient relevant observations regarding his condition. So the doctor told the patient that he needs to be transfused with blood immediately because he has low hemoglobin and hematocrit levels. What ethical principle was used by the doctor? Letter A, veracity. Letter B, fidelity. Letter C, beneficence. Letter D, justice. What do you think is the answer, kapatid? Okay? So, ayan. What do you think is the answer? Okay. Yan. So, the doctor told the patient that he needs to be transfused with blood. Yan, sinabi niya, no? Because the patient asked, no? Nagtanong dito si patient. So, what do you think is the answer? Alam niyo, sinabi ko to sa, I will always say this one in our, whenever there is a question on the matter of diagnosis, you need to tell the patient, okay? With all honesty, yan. With all honesty, yan, sincerity, at merong po tayo ditong truthfulness. Yan, truthfulness. So, we will be divulging, yeah, we should be telling the truth. Okay, so the best answer dito, kapatid, is letter A. Yan. Okay, letter A is the best answer. Pero, I will be giving you a specific concept, kapatid. Sabi ni Lydia Benson, there are some situations wherein we may hold some specific information even if they are true. Okay? Even if they are true, kapatid, no? Even if they are true, as it may further harm the patient. So say for example, nag-verbalize ang pasyente mo na magpapakamatay siya, yan. Kapag nalaman niya na may sakit siyang HIV or kapag ma-diagnose akong HIV, I will really commit suicide, ayan. Tapos nagkataon, no, na lumabas yung diagnosis ng pasyente that the patient really is positive for HIV test. So, what do you think is that concept, kapatid? Yan, sabi yan ni Lydia Benson. Ayan, ang galing, no? Ang galing ni Paulo Manuel, okay? So, sabi ni Lydia Benson, kapatid, meron tayong tinatawag na concept na benevolent. Yan. benevolent deception. Okay? Benevolent deception, kapatid. Yan. Benevolent deception is a concept wherein where you hold some information, holding out information, okay, information as it may further harm the patient. So if it could harm the patient, kapatid, might as well no na i-hold muna natin. Hindi naman tayo nagsisinungaling. We will just temporarily hold the information as hindi siya rightful to be disclosed at the moment. Okay? So, pero if you will be asked generally, no, the general concept there is you need to be truthful, you need to be honest with your patient at all times. Okay? So, letter A is the best answer here. So, let's have another question. Okay? At the front door of X-ray rooms, there is a common instruction poster that informs client to tell the radiologist if they are pregnant because it has teratogenic effects. What ethical principle does the situation represent? Letter A, autonomy. Letter B, fidelity. Letter C, beneficence. Letter D, non-maleficence. What do you think is the answer here? Yan. So, this is also tricky and this is also kind of mahirap siya para sa akin. Okay? Because parang lahat tama, no? This is the situation we're in. Hala, parang lahat tama, no? So, A, autonomy. Letter B, fidelity. Letter C, beneficence. Letter D, non-maleficence. What do you think is the answer? Yan. Okay? Yan, magagaling, magagaling. John Prade, Kiara, Paolo, Kate Sabay. Yan. Of course, no, the correct answer here, yan, Song J09. Yan, the correct answer here is non-maleficence. Okay? So you might be entangled with between your beneficence and then your non-maleficence because you might be thinking, hala sir, di ba doing good naman yan? So that might be beneficence letters. Yes, this is doing good. However, non-maleficence is a more specific answer. I will try to explain that to you now. Okay. So kapatid, para hindi tayo malilito, when you are approving something that is correct, okay? When you are approving something that is correct, so this is your beneficence, okay? When you are approving or where you are trying to do something that is correct, okay, that is beneficence. But when you are actually avoiding, yan, if you are avoiding something that is wrong, something that is bad, something that is wrong, something that is bad, then that is non-maleficence. Okay? So, ibig sabihin, kapatid, maleficence. So, paano yan pumapasok? Halimbawa, when a nurse tries to avoid when a nurse tries to avoid engaging with abortion, so that's non-maleficence. Okay? A nurse tries to avoid illegal drugs, that's non-maleficence. A nurse tries to avoid um, unhealthy practices, so that's non-maleficence. But when you try to approve, or when the question is just telling you that the patient is trying to be good here, or then the nurse is trying to be good here, and she's following a certain standard, then that's just beneficence. Okay? So letter D for this question is the correct answer. Ayan, gumagaling na tayo You prevent harm, safety, yan. Okay? Non-maleficent safety. Okay? Very good. Magagaling na mga nilalang. Okay? So, let's have another question. Mrs. Gomez, who has cancer of the uterus, submits to hysterectomy, will not be able to bear a child. So, if she does not have the operation, she will also die. So, kapag daw si Mrs. Gomez na may hysterectomy ay hindi magpa-opera, may cancer, yan, and then magpapa-hysterectomy, hindi na siya pwedeng magkaanak. Okay? However, kapag hindi naman siya magpa-opera, she might die. Okay? So, it is the gynecologist's intention to help the mother and not to harm her. So, what ethical principle will explain the situation? Ayan, so parang nagdadalawang isip na si um Mrs. Gomez. So, ano daw ang ethical principle? So, papasok na tayo sa ethical principle dito, kapatid. Yan, I highlight that what is the ethical principle na nakikita natin dito. Letter A, twofold the defect. Letter B, totality. Letter C, no one is obliged to betray himself. Letter D, if one is willing to cooperate, no injustice is done to him. What do you think is the answer? A lot is answering letter A. A. Paulo Manuel, Kid Sabay, Gabubo. Sir Gabubo, kaano niyo po sila, Bubo? Chara Roa, Angela Milano. Okay? Yan. Evane, Matusalem, nor Yasmin Salain. Yan. So the best answer here, kapatid, is of course letter A. Okay? So letter A is an ethical principle wherein, kapatid, you see things, okay? You see things here. You see things, sees things, okay? Things as either, yan, either good or bad. Ayan. So kapag makakatulong sa'yo yan, then you do it. Kapag hindi naman, then you don't do it. So ganun lang. So ganun lang, kapatid. You just see things on two way. Either para siyang, I call it myself as your black and white. Di ba may mga ganong tao na kapag ayaw nila, then ayaw nila. No other words. So ganun, may mga taong ganun, no? So, totality naman, kapatid, is of course from the word itself, totality. So, halimbawa, no, ng totality is kapag meron ka ng, halimbawa, meron tayong lower limb impairment or nagkaroon tayo ng amputation sa lower limb, so it will affect the totality of us. Okay, so, yan. No one is obliged to betray himself. Ito yung ginagawa natin sa Senado at sa Kongreso, di ba? Yan. So, I invoke my right against self-incrimination. So that's an example of letter C. Letter D, if one is willing to cooperate, no injustice is done to him. So say for example sa mga, halimbawa nasa MRT tayo, nasa LRT, nasa train, no? And then may pasyente na biglang nahimatay, and then kala natin no simple lang, pero nagka-cardiac arrest na pala sa pasyente. So you did what you did is nag-CPR ka, and then well alam mo naman how to do the CPR. However, hindi naka-survive si patient. So no injustice is done unto you. Okay, dahil tinulungan mo yung pasyente. So totality is whole is greater than its parts. Yeah. Mamaya we might be cutting across some questions on that. Okay? Sige, let's have another question here. Mr. Raul, a diabetic man with gangrenous foot, consented to an amputation. So nagpa-amputate si patient dito. Amputation will save the patient's life and he can still walk through the aid of crutches or artificial limbs. So what ethical principle is involved? So sinabi na natin to kanina, kapatid, that it's totality. Okay? So totality, kapatid. So because you've been amputated now for the entirety of your your entire body to still function, kapatid, of course, no, you will be needing some artificial limbs, you will be needing some assistive devices for you to walk, because we want to save the entirety of you. So, okay? So the sum or the whole is greater than any of its parts. So yun ang ibig sabihin, kapatid ng totality. So mahalaga pa rin na that you're able to function out of the remaining limbs that you have, out of the remaining capacity that you have. Okay, so kailangan pa din na magpatuloy. Okay, so letter B for this question is the best answer. Okay? Ayan. So parang lahat naman nakakatama. Lahat actually. You know what, ang PALMR, pagkakaiba ng PALMR sa ibang concept at ibang subject. Kapag ang PALMR, alam mo na yung konsepto, then alam mo na yan. It can't go out of you. Okay, so hindi ka pwedeng mawala dyan. Okay, dahil not that I'm saying that it's memorization, but what I'm trying to say is that when it comes to your PALMR, kapag alam mo ng konsepto, alam mo na yan. You know how to apply it. Not like your medical surgical nursing, then you need to analyze. Ano ba to? You need to memorize all of those normal values, and you need to connect and think of the pathophysiology, why some things are happening here. So what are the necessary interventions na kailangan gawin? So ito, kapag alam mo na yung konsepto, that's it. You apply it. You just apply it into situation. Okay? Yeah. Okay. Next number. When Hermione, a manic patient, went berserk, She was restrained because the doctor cannot be contacted. Yan. So which moral principle applies to this situation? Letter A, a two-folded effect. Letter B, the principle of totality. Letter C, Epikia. Letter D, golden rule. Yan. What do you think is the answer here? Okay. So what do you think is the answer? So nagpapanik daw dito si pasyente, no? When berserk talaga, manic patient. So nirestrain ninyo. So what do you think is the answer here? Anong moral principle ang ginawa natin dito? Yan. Letter A, two-folded effect. Letter B, totality. Letter C, Epikia. Letter D, golden rule. Okay, I wanna see your answers, kapatid. What do you think is the answer? Okay. When we say Epikia, kapatid, what is Epikia? What do you think is Epikia? Sige nga, I will be waiting for your answers in the comment section. What do you think is Epikia? Yeah. Rhea Kenya. Yeah. What do you think is Epikia? Can someone answer me please what is Epikia, kapatid? Epikia is actually simply as golden rule. Alam niyo yung golden rule? This is the golden rule na alam natin, no? Do not do unto others. Do not do. Yan lang. Do not do unto others what you don't want others do unto you. Ganyan lang. Okay? So when we say Epikia, kapatid, very good. That's exception. Exception to the general rule. General rule. Okay? So very good. Guys, ganito. Ang tanong dito is, may manic patient tayo na inaatake. So she was restrained. Yan, restrained siya because the doctor can't be contacted. So which moral principle is or applies in the situation? So tandaan natin, go Rhea talaga. Okay? So para mag-classmate kayo, no? Okay, so ganito yan, kapatid. Ang nangyayari dito is nag-berserk si patient and then she was restrained. So if the patient is actually if the patient is actually violative, just like what we have in the situation, the doctor must see patient, okay, within 1 hour. Okay, so kapag violative kapatid si pasyente or violent, yan, violent, combative, so the doctor must see the patient within an hour, and then si nurse, kapatid, must check the patient. RNs must check patient every, okay, 15 minutes. That's if, kapatid, si pasyente ay combative. Okay? So kapag non-violent, kapatid, ang ginagawa naman dito, the doctor must, okay, must see patient within 24 hours. Okay? Within 24 hours. So kapag non-violent si patient, okay lang na madelay siya within 24 hours, and then si nurses must check patient. Okay? Dapat i-check ninyo si patient every 1 to 2 hours. So that's how are we going to check our patient. So that's how frequent our checking to the patient is. Okay? So of course, no. So dito, kapatid, we applied the Epikia, the exemption to the general rule. It's because combative nga si pasyente. Okay, so supposedly, titingnan muna siya ng doktor. Yan. So when you do that, kapatid, sa emergency, usually we apply the exemption to the general rule. Okay? In emergency, this is the most predominant ethical principle or ethical moral principle that we are applying. Let's have another question, kapatid. So a research study is being conducted by a group of nurse researchers. So Eileen, 25 years old patient confined in a medical surgical ward, subject herself willingly to an experimental drug after she has been told of the possible side effects of the same. The research did not violate any principle of human rights. So the moral principle used is letter A, one who acts through an agent is himself responsible. Letter B, no one is obliged to betray himself. Letter D, the end does not justify the means. Or letter D, if one is willing to cooperate in the act, no injustice is done unto him. What do you think is the answer? Big word dito, ha. willingly. Yan. She willingly subjected herself. Okay? Yan. What do you think is the answer? Yan. A, B, C, or D? Ano ba yung nag-undergo siya sa isang experimental drug study, no? So what do you think is the ethical principle that applies here? Yan. What? What do you think is the answer? Ayan, it's quite obvious actually. Yeah, mirroring. Yeah, 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 yeah. Yeah. If one is willing to cooperate, kapatid, yeah, no injustice is done unto him. Yeah. Okay? Yeah. If one is willing to cooperate, no injustice is done unto him. Okay? Kasi nga, may mga, di ba, that's why it's a very, very standard practice in research, in nursing research. Not only nursing research, but in research as a whole concept. So we always do your consent, no? Okay. Yeah. During an epidemic, kapatid, yan, mirroring techniques. Yeah, yeah, yeah. During an epidemic, immunization against communicable disease is administered to the people. So although there may be some who may have slight reactions to the vaccine, the greater majority of the populations shall be considered rather than the isolated few. So, ano nga ba ang ginagamit natin ditong principle? Letter A, no one is held impossible. Letter B, the greatest good for the greatest number. Letter C, a little more or less does not change the substance of an act. Letter D, the end does not justify the means. So what do you think is the answer? Okay? Yeah. What do you think is the answer here? This is good. This is actually a good question. Okay, so of course, the best answer for this one, kapatid, is letter B. Yan. And this is what we call as your principle of utilitarianism. Yan. Ang tawag natin po dyan ay utilitarianism. Utilitarianism. Okay? So B po is the correct answer, kapatid. Okay? So you do the greatest good for the greatest number. Whenever you are entangled on two things, to select on two things, and then uh, one on the other hand and the other on the left, one on the right hand and one on the left hand. So piliin mo, kapatid, kung saan makakatulong sa mas nakakarami. So do the greatest good for the greatest number. So utilitarianism po ang ina-apply natin dyan. Okay? Go, Mikay. Nagsusuportahan kayo. Ha, ginawa niyong ano, yan, si Rhea tsaka si Micaela Atamosa. Okay, so let's have another. Anonymity, yan, is the name given to the procedure that ensures subject that the responses letter A cannot be identified by anyone. Letter B will not be shared by anyone. Letter C will not be destroyed at the end of the study. Letter D will be kept under lock and key. What do you think is the answer? Napakasimple nito. Anong ibig sabihin ng anonymity? Yeah. Of course, no. The best answer here, kapatid, is letter. Yeah, letter. Okay, letter A. Okay? So when you say anonymous, kapatid, di ba, you can't be identified. So A is the best answer. Okay. Yeah, A is the best answer. So anonymity, big sabihin, you will not be able to be identified. Okay? So what is letter B? Will not be shared by anyone. Anong ibig sabihin ng letter B? What do you think is letter B? Bakit hindi siya tamang sagot? Ano ang letter B? Ang letter A, anonymity. Anonymity. Yeah. Okay. What do you think is letter B? Letter B. Who can give me the correct answer? Yeah, very good, Paulo Manuel. This is confidentiality. This is not anonymity, but this is confidentiality. Okay. So, hence, that's not the correct answer. So, yeah. Okay. Yeah. Very good, very good. Very good. Okay. So, I'm getting those. Babasbas naman, sir. Yan, babasbasan ko na kayo. Yan. So, chillax lang, kapatid, ah. I know that everyone or there are some of you no, na very anxious na, but of course, kaya natin yan, kapatid. So, eto. The use of other person's idea or wordings without giving appropriate credit or citation results from inaccurate or incomplete attribution. to when another person's idea is inappropriately credited as one's own is what we call as your. Ayan, okay? Sa Hermoso. So this is what we call as anong tawag natin dito? 'Yun, yung mga ginagawa natin 'di ba sa research tayo tapos alam natin feeling natin ang galing-galing na natin 'no, taga-timpla lang naman tayo ng kape tsaka tagaluto ng pansit canton sa bahay ng kagrupo natin tas isa lang yung gumagawa ng research natin, 'yan. So 'yan, dun tayo magaling, eh, 'no? So the best answer for this one is of course alam na natin 'to. This is plagiarism. Letter B is the best answer. Okay, so always take and always give credit kapatid sa mga may akda. Okay? Yan. So let's have another question here. Okay? Let's have another question. Taga-type lang. So the client, after explanation by the nurse researcher about a particular research, accepts participation of the study. So the ethical principle involved is letter A, autonomy, letter B, beneficence, letter C, non-maleficence, letter D, justice. Alam niyo, you might be asking, Sir, ba't paulit-ulit po yung madadaling question? Alam niyo, paulit-ulit din yan sa board examination. But if you don't know the basic concept of it, ay nako, napakalaking sayang. Okay? Kasi it should be bonus. You know what? Your PALMR questions supposedly should be bonus questions. Kapag PALMR na po ang question, ay nako, dapat ay nasasagot na natin yan. Lalong-lalo na pagdating dito sa mga basic ethico-moral principles. Okay? So, dito kapatid sa research, okay, autonomy pa rin po. Okay, kasi the word accept, no, tinanggap participation of the study. So, autonomy, freedom from coercion. Ayan. Okay. Magaling kapatid. Sige. I think we can have last two questions for our session para makatulog na din tayo, di ba? Yan. Sayang ang points. Yeah. Correct. Okay. There are several types of leadership, kapatid. So, what is the style of leadership demonstrated by physicians during a code blue? I answered this one in I think nasa TikTok to or nasa, I don't know if this is part of my, yeah. So what do you think is the answer here, kapatid? Letter A, consultative, letter B, permissive, letter C, bureaucratic, letter D, dictatorial. Yeah. What do you think is the answer? Okay. Yeah. Okay. Of course, it's the best answer dito, kapatid, is letter, ayan. So, consultative, no. Permissive, no. Okay? So, bureaucratic also no. So, the best answer dito, kapatid, is dictatorial. Ganito, kapatid. During emergencies, yan, tandaan natin, in our emergency, kapatid, the best answer for that is always dictatorial or kapag hindi mo yan mahanap, kapatid, okay, you find for authoritarian. Okay? Authoritarian. If you will not be able to find the word dictatorial, yan, you look for the authoritarian. Okay? Yan. So, tandaan natin yan. Yeah, one person lang, mang. Okay? One person is leading. Okay? Or a group of person. Just like in your code blue, di ba? One person is leading. Okay? So, halimbawa, on my 3 or my queue, yan. Di ba isa lang nagsasalita during code blue? Okay? So, yan. Yeah, if di nyo din maharap, you can also have your autocratic. So, in this case kasi, dictatorial is there. So, it's the best answer. It's a no-brainer question actually. Yeah. So, yan. Okay. So let's have another question, kapatid. Yan. So which of the following is true about planning? Select all that applies. Letter A, planning helps organization adapt to change by identifying opportunities and avoiding problems. Letter B, it sets direction for the other organization. Yan. And for teamwork. Letter B, C, planning improves decision making. Letter C, all levels of management engage in planning. Yeah, what do you think is the answer? Yeah. Okay, ito medyo mahirap to, no? Yeah. May mga ganitong format po sa ating licensure exam. So where you have here another set of letters and you have here subset of letters. What do you think is the answer? Okay? Okay. Of course, no. The best answer here is letter okay, letter C. So tama po lahat ito. That planning, kapatid, is your frame dito, lahat dito. So alam ninyo sa ating pong management, okay, balikan lang natin to ng mabilisan. Ang konsepto po ng management is just composed of your basic processes. What are those? Planning. Ano ba ang composed ng management po natin? Number one, planning, organizing. Letter number three, controlling, and letter D. Number four is your no, POD. Number three is your directing, and last but not the least, your controlling. Okay? So it's a very, very easy concept, kapatid. Okay? So tandaan natin yan. Ano yan? Yeah, okay. So, okay. So maraming salamat. I hope and I pray naman natutunan tayo. It's 2:02 na already in the morning. So antabayanan po ninyo more of our Q&A. So good night and continue striving and continue grinding para sa mga nalalabing oras, no, for the licensure examination. I know that uh, everyone can do it. Okay? So maraming salamat po and have a good night, everyone.